The National LCAV Research Portfolio will support the implementation of Commitment 7 and further increase the visibility and impact of nursing and midwifery research. It has been a remarkable experience for me to be the first clinical fellow for leading change adding value. The highlight of that has been co-leading the development of the National LCAV Research Portfolio with the Council of Deans and other key partners.
The Council of Deans of Health was delighted to co-develop the National Research Portfolio for the Leading Change Adding Value framework with the LCAV Clinical Fellow and key partners. It's a fantastic opportunity to celebrate and showcase the contribution that nursing and midwifery researchers make to improvements in care and innovations in care.
My project is a behavioural project investigating the behaviour of nursing staff when they're responding to deteriorating patients within the hospital environment.
Having an interest attracted me into nursing research, identifying a problem and wanting to make a difference, to really make a change and implement some change. So my area of interest in research is very much about how nurses can have an impact on the health of the population by acting as healthy role models, and that led me into my recent research projects.
So I am particularly interested in how people think about risk in terms of pregnancy. So my research has looked at how women think about risk in terms of where they want to give birth. So women with more complicated pregnancies, those who choose to give birth at home, perhaps against medical advice, and also those who choose to give birth in hospital following medical advice, how women make those decisions and how they think about the risks involved in each place of birth and in birth generally. And then also contrasting how women think about risk in pregnancy, how midwives think about risk, and how obstetricians think about risk, because we tend to assume that everybody thinks about risk and safety as similar concepts, and actually that's not the case.
My clinical area has always been healthcare for older adults and in acute care, and I think for me unpacking that complexity of what it is about a nurse's work with patients that is beneficial, the aspects of work that maybe are less beneficial than we'd hope they would be. So trying to unpack that complexity, looking at what works, patterns of why different interventions work, and increasing our knowledge of exactly what it is about nursing and the way in which nurses work that has an impact on patients, not just their clinical outcomes but their experiences of care as well, and of course for their families, because they're such an important part of the way in which we work with patients.
Well, nursing research shouldn't just influence policy, but it should be at the centre of it. One of the recommendations of my study was that nurses should influence change by being at the very centre of policy. My top tips for enabling nursing research is to have a passion, hold the line, don't give in, and have the support of your profession.
I think midwives are ideally located for research that's going to affect how we care for pregnant women, how we care for women and their families, and also supporting midwives in their practice as well with professional issues. So we are the people with direct experience on the ground of the issues that affect women and midwives every day.
Finally, as an aspiring future research leader, being part of this process has been truly enjoyable and has supported me to develop my research knowledge in nursing and midwifery further. The long-term plan for the future of the NHS is setting out ambitions for the next decade, and nursing and midwifery staff are leading work and research in many of these areas.